Well, hello. This is my first time to get to treat you, so I'm very excited. Basically, before we get started, I like to just do a full analysis and really look and assess your face and make sure we're on the same page as to what your goals are and what you're wanting to accomplish with your treatment. We have your before pictures here that I've actually already been looking at and kind of getting a game plan for you to get going. When you look at yourself, what is it that is bothering you or that is bringing you in today?
Basically, this right in here is really bothering me.
So your marionette lines that are kind of, yeah. So that's a very common complaint that I hear quite often from my patients. So basically why that's occurring is because our faces, our skull is actually shrinking as we age. So we're losing that support underneath to hold us up. Also, the fat pads on our face can start to shrink and kind of fall downwards. The goal is going to be to replace the volume loss that's occurred over the years to help lift that up. A lot of people will think, oh, well, why don't we just put the filler right into these lines? And the reason is because if I were to just put filler right here only and not lift, what can happen is it can actually just cause the lower face to look heavy. So if you look straight ahead, you can actually see how by lifting, it's going to lift the nasolabial fold and the marionette some. See that?
Oh, yes.
And then if we extend the chin a little bit, because our mandible or our jawbone chin is actually shrinking up as we age, by extending through here and lifting here together, it will stretch this more taut and help make that kind of disappear. Yeah. I do like to put some filler through here as well, but I like to use a cannula to help lift the corner of the mouth. But without giving the structure support first, it's just going to look heavy here. So there's some other things.
Yes, my lips.
Yes. As we age, what's happening is our volume in our lip is actually kind of shrinking or going away. So by replacing the volume into the lip, it's going to make the lines around the mouth look better too. Another thing is chasing the problem again. So if we just chase the problem, put filler just around the lines of the mouth, what's going to happen is we're going to start to look monkey-like or have this projection around the mouth instead of in the lips. And then it even makes the lips look smaller, which is not the look we were wanting.
Right.
So by giving you a little bit of hydration and plump in the lip and then defining your lip with some hyaluronic acid filler, it's going to look really pretty and natural.
Okay.
The other thing, I was noticing you have these beautiful cheekbones, but we are getting this little bit of hollowness under our eye. So part of the lifting process for your mid-face or your upper face is going to be to restore this volume loss under your eye. And then I'm going to have you make some movements for me. So go ahead and frown for me. Push your brows together. Good. So this little horizontal line that's forming here, this crease, it can kind of give us, even at rest, it can almost give us that angry appearance when we're not angry. So I think doing a little Botox or Dysport through here will help soften that line for you, and it'll just look very pretty and refreshed. And then the other thing for you is just I think smile lines are pretty. At 64, I think we should have some lines there. We definitely don't want to freeze your face to make you not move. But by doing just the slightest amount of neurotoxin or Botox or Dysport here, we can soften these lines and help keep them from getting deeper, but still keep your natural movement.
Okay.
When we're choosing products, I know we have tons of different fillers to choose from, and so I'm trying to pick a filler that's going to, for your cheeks, going to give you some support. Also for your chin, I want to build structure in the chin. So we're going to use a thicker filler. So either Voluma or Lift is what I like to use in that area. For under your eyes, I'm going to use Restylane, which will be very smooth and subtle and just kind of help fill the void there that you're getting. And then for lips, I'm actually going to use a combination of two different fillers. I'm going to use Restylane, that's going to help give us some definition, and then I'm going to use some RHA3 to help soften the lines in your lip.
Okay.
And then last but not least, we may do a little bit of define in the marionettes depending on how things look after we lift and contour your chin.
Okay.
So I think we have a good plan. Do you have any questions?
No. That was the
main
reason. Yes.
Lift there. So, well, since you're here today, we get to have fun and do a full face transformation for you.
Sounds great.
Yes.
Okay.
Right.